Hey, this is Dr. Thaddeus Gala. Welcome to the Longevity Podcast, where we cover the top tips and research to living a quality, vibrant, healthy life to 150 and beyond. I'm Dr. Thaddeus Gala, and my mom, Melanie Jorgensen. Welcome, Mom. It's good to be here with you today.
It's wonderful to be here. Thank you.
Today, we're going to be talking about pain. If you have pain, or if you've experienced pain, or you think you may experience pain at some time in your life, you're going to want to listen to what we're talking about today, because this is something that, of course, we all can encounter and learn more, to do more, and be better with. Because whether you have pain now or whether you have a loved one that has pain, it's going to be something in your life. So I know this is going to be a video today, or audio, however you're viewing this or listening to this, that you're going to enjoy. So obviously, you're the lead health coach, within our organization. What is it that you find when you're working with patients? And I'll give my presentations. Well, what do you find is the number one misconception that people have about pain that's lingering or not going away, or just in general?
I think that the misconception is that it should all go away very quickly, in spite of the fact that they've had this chronic pain maybe for years and years, that a couple of weeks or months of making huge changes in their diet, and that why are they still having the pain? And
it just as you're saying, it reminds me what I tell patients is when they come in, they say, why aren't I getting healthier faster? So, I've yet to have a patient that came in and said, I wish this would have taken longer. Mm-hmm. So I think, all of us want to be healthier, faster, sooner, yesterday kind of thing. But there's a couple of things to keep in mind when it comes to pain. And because pain can be very debilitating. It can wear on people. It's caused divorces. It's caused, people to quit jobs, leave jobs, to do things that they normally wouldn't do. It can lead to painkiller addiction and a lot of other things that can happen. Now, obviously, that's more the extreme, but even on a day-to-day basis, it takes quality of your life. You can't do the things you want when you want. You sprain your ankle, you hurt yourself, it heals longer. So we're going to be talking about some of the top tips and things that you can be doing to start reversing your pain, reducing your pain, start feeling better, so you can start, if you do have an injury, you heal faster, or if you are suffering with pain right now, you can work towards getting rid of that faster. And one of the things to keep in mind is that your body is very plastic, meaning it's very moldable, and it can respond very, very quickly. I've had people that obviously have come in that have, sometimes they've had years of chronic pain and they get rid of it in a couple days. Other people have years of chronic pain and all we can do is just reduce that chronic pain. Everyone's different, and your body's either getting healthier or getting sicker. So when you are dealing with all of your chronic pain, just to give a quick backstory, of course, my mom has a long history of fibromyalgia. Now it's in complete remission, but to a point of where she had debilitating pain. Doctor said she'd be in a wheelchair, all those kind of things. So what were the things that were going on in your mind when you're dealing with pain that, what were some of your biggest frustrations when you were dealing with pain and you were looking for solutions?
The biggest frustration I had with the pain was that there was no quality of life. There was no reason to get up in the morning, because I couldn't do the things that I once had been able to do and that I really enjoyed, and it was so discouraging. Chronic pain just robbed me of the quality of my life and the hope I had for a future. It was, it was a very unrewarding life, and it was a time, the only time in my life when I actually did think my family would be better off without me. Mm-hmm. I'm thinking about a client that I have that is has been dealing with such chronic pain even since childhood for some issues, and has come into our program and is starting to experience some relief of his pain. He's in his 50s now, but it's still going so slowly for him. And something I find interesting, Dr. Gala, is that surprised me as his health coach, is that he has more energy. He's able to exercise without exacerbating his pain. He's sleeping better. There are so many other benefits, but he still has this gripping pain. It's hard to explain. You think, well, somebody has all this pain, how can they have more energy? But he does. He says he's actually able to be up and do more things, longer periods of time a day, but that pain's just still not letting go of him. The shoulder, back, lower back, hip pain.
Well, when it comes to pain, there's a couple key points that's important to understand, and mainstream medicine isn't going to tell you this. And that is that 99% of all pain is nociceptive, which means it's an inflammatory type response. even neuropathic pain, we now know there's research to suggest that it's related to inflammation. And what do I mean by all those big words? Well, what I mean by that is that when you're looking at pain, the pain is a chemical process. And that can be triggered either in the periphery or more centrally or actually even up in your brain. So ultimately, pain obviously is experienced in your brain, not in the periphery. Because if you can take something and you mask and you give a nerve block or stimulation, you don't feel the pain here. Just like people with phantom limb pain, let's say they maybe don't even have a limb, they can still feel pain in their hands. So ultimately, we know that the pain is in the brain. Now that doesn't give you an excuse to to tell your spouse or your loved one that, hey, it's all in your head, or tell them they're crazy or anything like that. Okay. But to illustrate the point that pain is in your brain, and it's and it can be modulated by many, many things. By the chemical imbalance, both from nutrition and supplements, environmental toxins, how stressed you are on a day-to-day basis, as well as a major life event. Loss of a loved one can make your pain go up or down, as well as stress just borderline stress at home or at a job or with finances or whatever else is in life can obviously raise stress and therefore raise inflammation and raise your experience of pain. Because it's important to realize that pain is an emotional experience. The amount of pain that you experience in your brain does not equate to the amount of damage in the periphery. And one of the points of that being is that you can, I've for instance, I've had people come in, I've looked at their x-rays, their MRIs, their imaging, and their images look perfect. But they're in debilitating pain. I've seen other x-rays and MRIs that look like a complete mess, and they have no pain. So we know that physically how you are it plays a minor role in terms of your ultimate experience of pain. Mm-hmm. Now, obviously, with chiropractic, there can be the adjustment does an amazing job of calming down the nervous system. When you go into your mainstream medicine provider, they'll give you drugs, which is obviously a chemical component. But we know that a couple things that the things to be careful of is that when you have pain, some people say, "Oh yeah, I just have a high pain tolerance." Well, why is that a problem? The problem that when people say, "Oh, I have a high pain tolerance," and kind of wear that like as a badge of honor, is they don't realize that it's kind of like riding a bike. When you learn how to ride a bike, you always know how to ride a bike. It's also like a foreign language. When you learn a foreign language, you learn it, but you don't always retain it forever. I'm willing to bet if you've taken a foreign language, that if you were to look back when you were at the very best, that you probably don't know the same vocabulary, grammatical corrections, all that you would be able to when you really were immersed in it. So we know that you can forget it, but you can also bring it back. So if you are dealing with pain on a regular basis and you just kind of suck it up without actually getting to the root cause, you're essentially telling your body that you want to be really good at feeling pain, and therefore the next time something comes along, you're hypersensitive to it. You're kind of on high alert. So I'd like to ask you, when you were going through your chronic pain, what was that like for you in terms of doing just daily type examples? I'd like to hear of how you believe that would equate to things you experienced, to where normal activities would cause a painful response versus where you're at now.
Well, I have no pain now. I mean, I just don't. I feel my fibromyalgia. There's no question to me. It's in total remission. It's not even the same person, the same life. I remember vacuuming when the house would get so bad that I knew I had to get that vacuum out. Just the process of pulling the vacuum out of the closet and setting it up and trying to push it across the floor and do that was very painful. It was painful throughout my entire body. Just the standing. I'll take another activity. Just standing comes to mind, which is why I was remodeling the kitchen for a wheelchair. Because standing in the kitchen for any period of time, just to stand there and cut up an onion or something like that would be. It would just be so painful. Wash dishes. It was very, very painful. And now
I remember you used to have braces. You couldn't write. You couldn't,
right.
A lot of things.
Right.
So let me say this. Now, obviously, and this goes for whether you have headaches, whether you have migraines, whether you have low back pain, neck pain, chest pain, arm pain, neuropathy, whatever pain that you have, the things that we're talking about equate or are important to understand with that. And one of the things to understand is that if you're doing a normal activity that other people aren't experiencing pain with, and you have pain, then you have inflammation and there's something wrong. So for instance, if you wake up and you have daily headaches, or if you have headaches once a week or once a month or even once a year, that's not normal. You shouldn't have headaches on a regular basis. Neck pain, back pain, arm, wrist, shoulder, joint, etc. So whether it's, psoriatic arthritis, whether it's osteoarthritis, rheumatoid arthritis, fibromyalgia, Sjögren's, autoimmune condition, whatever the case is, we know that inflammation is at the core, which is why when you go into your provider, what do they give you?
Pain medication.
Right. They give you pain medications. If that doesn't work, then what do? They give you a steroid injection. If that doesn't work, then they give you some morphine. They just keep upping it. And it all comes down to a chemical basis. So regardless of the pain that you are going through or have, or discomfort, if the important distinction is if you can't do a normal activity pain-free, and I'm not talking about going out and really exerting yourself, exercising, but if you can't do a normal activity such as washing dishes, sitting down, walking, if you can't do a normal activity and have it be feeling good or normal, then you have pain. Now, obviously, if you sprain your ankle, there's going to be a period to where you're not going to be able to walk normal because your body's healing, and that's important. But once that ankle heals, and obviously you should be doing the right things to help it heal and so forth, then you shouldn't have pain in your ankle anymore. If you have pain from a previous injury, that shows that you have active inflammation in your body. So in terms of where we're at, I want to go over some of the biggest tips that I've found to help reduce pain, both short and long term, and then as well as some habits. I'll go over some of the key points, and then I'd love to learn some of what you've done in terms of habitually, how do you integrate that into a daily lifestyle. Right. So the biggest things where you're going to typically get the best bang for your buck is going to be a combination of body work. What I mean by that, medical massage, chiropractic, body work like that, stretching, yoga, exercise. So just movement is going to be a huge one. It doesn't have to be huge, whether you're going in obviously for chiropractic adjustments or medical massage, or you're going out for a 5-minute walk, or you get up and stand throughout your desk during the day. Just movement is going to be huge. So number one, I'd say movement is going to be important. The other thing is going to be the inflammation in your body. One of the big ones being obviously foods that you eat. There's certain foods that are very pro-inflammatory and other foods that are anti-inflammatory. And one of the things to keep in mind is that it's cumulative, that the cause and effect between when you eat something and when it shows up, it can be delayed. I use examples similar to smoking. You can smoke people can smoke their whole lives and never get lung cancer. Some people smoke one pack and they get lung cancer, but it's decades oftentimes before it shows up. And then the other big one being supplements. So let's go ahead and jump into that. So of those three things, I'd love to hear how you integrate that in terms of daily movement and what habits do you do on a regular basis, nutrition, and then supplements. Obviously, there's a lot of other things that can cause pain. It can you're either intentionally or unintentionally causing pain, and a lot of other things that we're not going to get into today that can reduce pain. But let's talk about some of those first. So let's go ahead and jump in terms of daily habits that you're doing. What are you doing to improve your movement and your activity throughout the day?
Well, I move a lot. So if I have and each day for me is a little bit different. I try to start out as much as I can with my exercise routine first thing in the morning. And I make sure that happens by putting out whatever clothes I need the night before. I track my exercise every day. I've been doing that for years. So I check it off when I do it. And I have a routine. And again, I didn't start with this. If you go back 20 years ago, it was hard for me to walk. If I walked 5 minutes twice a day, that was my exercise for the day. Now, fast forward, and to keep my pain and my fibromyalgia in complete remission, I do an active exercise routine daily. And I rotate between strengthening, stretching, cardio, and I like meditation as well. I consider that part of my exercise routine where I'm actually sitting and just meditating. But I like to do that daily. And then I love hiking. I try to pick activities. I live near a golf course, and people say, "Oh, do you golf?" And it's like, no, I don't. And because to me, I prefer more strenuous activities. But again, if you're a golfer and you're listening to this, I do want to tell you I'm very impressed with how many I do see golfers out there, not in their golf carts, that they're pushing or pulling their golf clubs. That's pretty exciting to see that going on more and more.
What would you say when you're coaching people? What do you think is the biggest struggle or hurdle for people to get active?
Getting started. I think the biggest struggle that people have with getting an exercise program going is getting started. It's that first step because it's not part of your daily routine.
Right.
And you're busy, you have a full life. How am I going to eke out, a half hour to an hour for exercise? It's just how do I get started on that? Which is why frequently I'll encourage people 5 minutes a day. Literally get up and say, this is my 5-minute exercise. Write down what you did. And then you just begin to increase that with baby steps. But also be sure you do something that you like. Finding a buddy, somebody do it with you. That's the hardest part is the getting started, and then once you do get started, start small and get some little baby steps, I guess, to keep you going with it.
Well, one of the things I know that a client's done in the past, and I even tried to do this, what I think is great, is setting out everything ahead of time. So let's say if you're a morning person, you want to go exercise first thing in the morning, set out your clothes and your shoes and whatever you're going to do first thing or at night before you go to bed. So when you wake up in the morning, it's a no-brainer. You get up, get your stuff, you're ready to go, and it saves you that time. The other thing I like is finding a buddy, finding someone that you can do, whether it's hiking with, or whether it's going to the gym with, or playing racquetball with, or basketball, or walking with, whatever it is finding someone on there. The other thing that I obviously suggest, with background in functional or in physical medicine rather, is I suggest at a minimum getting a full body 1 hour to 1 hour to 90-minute medical massage every month, followed by a full spinal chiropractic adjustment to keep joints, muscles, lymph, nervous system working optimally, so when you are exercising, things are functioning and working the best they can. So those would be some of the things that I would suggest. Obviously, if you like more rigorous exercise, doing that. I also think setting a goal is huge and paramount. I remember back when I was in school, I was going to the gym, but I was past college, so I'd already done track in college, and I was in chiropractic school, and I would go to the gym, but I just wouldn't have that umph. Like, okay, what am I doing this for? And so I told myself, I'm going to do a triathlon. And of course, I had to go big. So I said, well, I'm going to do an Ironman. So I gave myself a year to train for an Ironman. I mean, obviously I had a lot of background leading up to that through college and high school, but I gave myself a year, and that completely shifted my motivation. So I'm not saying obviously you need to do an Ironman, but find something that you like, whether it's a local 5K run or a 1K walk, or maybe there's a group or something to where there's like a goal or celebration. I know one of the things I look forward to is going and doing the Great Wall of China Marathon. So I want to run, and that's going to give me something to look forward to, and it's going to be out there. So whatever carrot you can give yourself, I think is going to be huge in terms of you have value and excitement in working towards that. And when you get there, then have fun with it, and then look and see what else you're going to be doing.
Dr. Gala, I'd like to add to that, and that's excellent. Having a goal set and maybe even breaking it down into little, increment steps. And that can happen with somebody who says their exercise program is walking the mall. I go to the mall 3 days a week and I walk. A stopwatch can be very valuable for that you time yourself and you say, I'm going to see, I've got 20 minutes here, and I'm going to see how many times, I can go around, the laps, or, I'm going to get around the lap. I'm going to do 3 laps around the mall, and I'm going to time and see how quick that is. And
right.
Let's say it takes you, 20 minutes. I'm going to try and do that in 19 tomorrow.
And one of the things I love is also like a Fitbit. A Fitbit can be great for that because it's tracking it. You can set your goals, and it almost turns into a daily thing. And you can obviously challenge your friends and family and invite other people. It's a really cool app. So I love a Fitbit because it one thing that I noticed when I got a Fitbit is it really impressed upon me. Here I am, I'm thinking that I'm an athlete and I'm very active and all these things, and I'm holding myself to the standard. And it really impressed me. It was pretty quickly I realized how sedentary I actually am. Even though, throughout the day I'm going from exam room to exam room, I realize how much time I'm actually standing still, charting, or that I'm working on projects, or that I'm sitting, or whatever it is, that it really brought to my forefront that someone like myself, who I would have called myself an athlete, was actually getting less than 10,000 steps, for instance, a day on a regular basis. So having something out there, and I'm not saying you have to, go for the gold, but finding something that you can that's measurable, that's fun, exciting, that you're being active with, as well as, let's say, for instance, if you are, if you want to keep your body as healthy as possible, and, medical massage or physical therapy or chiropractic, whatever that is, whenever you make your maintenance appointment, then make your next one before you leave. Otherwise, 6 months or a year is going to go by, and you're going to be stiff or sore, or your flexibility is going down, and year after year, you're going to get more stagnant without making those routines. So active throughout the day, making your appointments, making your follow-up appointment. Like what I tell patients in the clinic that are coming in for regular treatments, I say, and let's say they're coming in for maintenance once a month. I always tell them, before you leave, set up your first appointment. I don't care if you have to call and cancel it 30 times. At least that way it's on your brain, and you're thinking, and and you're making it a priority until it becomes a habit. So the other thing I'd like to do is talk about nutrition. And obviously we know some of the big, most inflammatory foods, and I know I'm going to break some hearts here if you haven't listened to some of our material before. Some of the most inflammatory foods include grain products and dairy products, as well as refined sugar and processed oils, and even alcohol to a certain extent. So even just talking about that, making it without diving deep into those things, what are some of the things that you hear people say when they've cut back on grains, or let's just do more of a global scale. Obviously, you work with patients on a daily basis. You have your group classes that you're teaching. You're obviously in the trenches from that perspective on a daily basis. What do you find are some of the successes that people hear, and how fast do they start noticing pain going down when they start changing their chemical and inflammation basis through nutrition?
Oh, well, days. Literally days. People can start feeling better. When they say they go off the dairy and they go off the grains, they'll say, a comment I hear so often is, I had no idea it would happen this fast. And I'll be talking to someone who maybe has just been in the program for 2 weeks. That's really exciting to hear. That they'll say, I have more energy already, and my pain is beginning to decrease.
And the thing I'll add to that is that if you're listening or watching this, or obviously whether you're driving in your car or watching this at home or on the bus, wherever you're watching this, is keeping in mind that I know you mentioned grains and dairy. Those are big ones. There's literally hundreds of inflammatory foods. So I just want to put the asterisk in there that if you cut out grains and dairy, and I'm not just saying gluten-free, but going grain-free, but if you start cutting out those foods and you don't notice your pain improve, there's hundreds of other foods that can cause inflammation that just as easily will keep you on the track. But I know you're referencing that, but I just want to be clear that if you follow this advice and you aren't noticing reduction of your inflammation, there's probably something you're doing unconsciously or consciously without even realizing it that's keeping your inflammation elevated with other foods. So, what would be a patient example or a client example of someone that made changes? Like where would they be before? How long did it take, and what did they notice as an improvement?
Well, I'm thinking about, let's take fasting blood sugars, people that are dealing with diabetes, for example. The minute that they start making these kinds of changes, following our meal plan, for example, where they've really cut out these foods, that their blood sugars will drop within days, and within weeks they're talking to their primary care physicians about the necessity to start cutting their insulin and metformin and these other scary medications they're on.
So obviously reducing inflammation will help with blood sugar and so forth, but on the topic of pain, to bring it back to that, one of the things I look at is that, one patient that stands out in my mind was she came into one of our health classes on a Thursday. I met with her the next day. She started making changes. So she made changes Friday, Saturday, Sunday. She came back for a follow-up visit on Monday. Just by making some nutritional changes over the weekend, she came in on Monday and told me, Dr. Gala, I've already canceled my bilateral shoulder surgeries that I had scheduled for later this week, that I've had scheduled for months, that's been plaguing me for years, because of my inflammation is down so fast, so dramatically, that and for her, 3 or 4 days, her inflammation went down so much that she was able to completely disband her shoulder surgeries. And another client, I remember, he was getting ready to have knee replacement surgery, and he could only walk down he could only walk upstairs going backwards, because of the way his knee pain was. And after a couple weeks and months of making changes, he was able to not only walk up and down stairs, but I know he was also working on a shop, and he was going up and down a ladder. He actually jumped off the last few steps of his ladder when he was coming down, and stood there and kind of had this surprised look on his face, thinking, oh my gosh, did I really just do that? Like that was amazing. So I've lost track of how many people that were slated for knee replacement, shoulder surgeries, neck surgery, headaches, migraines, that when you start making these changes, your inflammation level goes down, and something that you originally thought was a surgical candidate is now no longer a surgical candidate, either short-term or indefinitely.
One of the other things I'm thinking about too with the pain reduction, so often pain is I've noticed in clients that I've worked with, is related to obesity, extra weight. And so again, when they change their diet, they begin to lose weight. And that can be a huge... I had one client who came who was having horrible knee pain, and she had a cane, and she was looking at a wheelchair. She could barely walk, wanted to have the knee replacement surgery, and her doctor told her that, well, I won't even consider surgery for you until you lose 50 pounds. So she came to our program, came to me wanting to lose 50 pounds. Well, fast forward, when she lost the 50 pounds, her knee pain was virtually gone. She went on to lose another 50 pounds and lost 100 pounds in a little over a year. And the knee pain was gone.
Well, I know, and that's one of the things that we look at is, yeah, I mean, obviously being overweight will cause inflammation. That can be a source of pain. The other thing is that there's very specific chemicals that cause pain that we know, and it's very clear in the research, because when scientists and myself and other researchers, when we look at these specific chemicals, we know that there's certain chemicals that cause pain, and there's very certain chemicals that reduce pain. And depending on what you put in your body with nutrition, will cause that pain level to go up, or I'm sorry, those chemicals that cause pain to go up, or those chemicals to go down in your bloodstream, and therefore your cells, your tissues. And that's why people with arthritis, neck pain, back pain, etc., basically anyone with pain, you can start to notice these improvements. So there's very key things. Now to be clear, a lot of drugs, like for instance aspirin was derived from white willow bark. So aspirin is called a COX-2 inhibitor. Now aspirin comes from a very specific compound, which is called a COX inhibitor, in white willow bark. And what we found is that people would chew on the white willow bark and it'd give them an analgesic or a feel-good effect. So now in nature, you should be naturally being exposed to subtle, low-grade anti-inflammatory chemicals, such as ginger, turmeric, spices, white willow bark, things like that you'd naturally get if you're living in a natural environment. But what we found is that we're so far from a natural environment, and a lot of these micronutrients that we should get to modulate and reduce our pain and inflammation are no longer present in today's diet. So the fact that they're no longer in our present diet, what we've done is, researchers over the years, what they've done is they've isolated this compound, such as in white willow bark, and they've taken out all the other things that were in white willow bark, and they've isolated this one single compound.
Okay.
So they've isolated this one single compound, but the problem is that one single compound, now they've not only isolated it and removed all the other things that were in it, and then they've also now increased that to a dose you would never find in nature, which is why the FDA, in the last few months, they've completely reversed their position and no longer recommend aspirin because it was killing too many people and a lot of other NSAIDs. So thankfully, they finally got on board with that. So the whole adage of taking aspirin a day, we now know is a fallacy. And thank goodness, even though myself and other researchers have been touting this for years, finally the rest of the medical community is no longer saying take an aspirin a day because research is there. So what we look at is, and that's one of the things we look at, like for instance, vitamin C and citrus. For instance, a lot of people think, I'm going to take vitamin C, but they don't realize that when they're eating, like say a lemon or lemon juice or an orange, that there's so many other health benefits. Right. It's not just the vitamin C. Right. It's all the other cofactors, enzymes, and chemicals that are also in the orange or in the lemon or in the lime or whatever it is that you're eating that are also crucially equally important. So if you take just this one chemical, vitamin C for instance, and isolate it out, you're not getting the full benefits and effects. Same thing with white willow bark. Now, I'm not saying that everyone should go out and start munching on bark or eating that, but I use it as an example. So we know that there's certain chemicals that we can isolate. Now, drugs are really a very distilled down, extremely powerful form of well, now we have a lot of obviously synthetic things that never were found in nature, but they're simulated after things in nature. But it's at a high degree potency that's never found in nature, which is why every drug and every medication has side effects, either overt or over the long term, it'll have side effects. And it's just every medication is cumulative. And we know that each medication you take, it adds up and it leads to a higher risk. Just like cigarettes. Like for every cigarette you smoke, your increases of risk of smoking or of lung cancer goes up. Just like for aspirin. Every aspirin you take, your risk of fatal stroke goes up. Every time you take a metformin, your risk of, now we know metformin, with the black box warning, if you take metformin, it's cumulative and the toxins build up in your body and can lead to lactic acidosis and can kill you. And so, all these things can build up over time, but it happens slowly and people have this mindset of, well, I've been doing it for 10 years. Why should I stop now? Well, that's like saying, well, I've smoked for 10 years and I haven't got lung cancer yet. Why should I stop? So there's obviously certain foods. We talked about, obviously grains and dairy are big ones. We also know very anti-inflammatory foods include lean, healthy meats, vegetables and fruit. Obviously, if you're not diabetic, and there's certain nuts. But obviously, even within that realm, there's the people way they cook their vegetables in the wrong oils can be inflammatory. So it's not always that easy, but when you understand the research, it can be. The other thing I'd like to talk about is supplements. Now, we know that supplements, for instance, fish oil is a big one. And a lot of people think, oh, well, why should I be taking supplements versus medication? Well, the differentiation is that medications are taking a chemical from nature or synthetic, and it's making it extremely powerful. Supplements are taking compounds that you normally find in nature or in food, and it's putting them in dosages that you would normally find in nature, and it's filling in gaps that you wouldn't have, but it's also in a higher dose than you normally find in nature to give you the extra dose, because most people are deficient, so they have to play catch up. So in terms of supplements, what do you do and I'll get into the ones that I recommend, but what do you do in terms of how do you set up your rhythm so where you're taking your supplements every single day, and how do you set that up as being part of your routine? How do you make that a habit for you?
Yeah, and you're right. The key is making it part of the routine so that it's like getting your clothes out the night before exercising. So you have the right clothes out. You get up in the morning, you see the clothes, you go do the exercise. It's become a habit, a routine. Same with my supplements. I actually purchased a kind of a this size shape rectangle small tackle box at a Sportsman, store, and I found that and it holds a week's worth of supplements, morning and evening, and I just bring all my little bottles down, and I just put them in the little dividers there, and of all my supplements that I take throughout the day. So I only have to bring the bottles down, maybe once a week, and they're all right there for me. And even that whole canister can go into a suitcase. It can go into my camper if I'm going to go camping. It also is very easy to take them all out and put them in little plastic baggies, Ziploc plastic baggies, to put in my suitcase if I'm going on a trip, or in my purse if I'm going to go out to a restaurant. So it's setting them up for the week and then just making sure I have them with me.
One of the things I love is I think what you just hit is, because we're busy and we need to get a routine. So I would say find out when you will normally take your supplements and do that. Because I know we've all bought supplements, myself included, at one time, and it sits on the shelf and you don't take it. Well, obviously it's not doing any good sitting on the shelf. So the things I would suggest would be, like for me, I have hard plastic travel containers that I can make, and I just put a little rubber band around them. So when I leave, I can just grab however many days I'm going to be gone, throw them in my suitcase, and I'm set. And what I'll do is often I'll put them into my my bathroom or my hygiene bag, with my razor and my toothbrush and all that kind of stuff. I'll put them in there because I know that I'm going to be doing that every day. So when I'm traveling, or I get to a hotel or I'm at a health conference, what I'll do is I'll open that up and I know that it's there.
There they are.
So wherever you're at the same place every day. So if you eat breakfast the same place every day, lunch the same place every day, dinner the same place every day, something that you do every day already, tie your supplements to that. Like for me, I usually will eat dinner. Well, I usually eat dinner in the same place every day unless I'm traveling. So that's where I anchor to. Some people, maybe they go out to eat at a restaurant, and obviously it's difficult to keep it in their car or their purse. Or maybe you're eating at home, or maybe you work at lunch. Every day you have lunch at your office, or your lunch at the same place. So make a habit of putting it in your lunch pail or your lunch bag. Right. The other thing that I would say is to make it easy is what I'll do is once a month is I will lay out all my supplements. I have a container like you said, and I'll lay out all my containers, and once a month I'll go through and open up all the bottles and I'll lay them all out. So I'm not every day having to open every bottle every day, which is huge. So you do it, it takes me 20 or 30 minutes once a month, and then all I have to do is just grab my handful of supplements, I take them, and it's there. So
I want to add another tip here. I've had a lot of clients who say sometimes taking the supplements is difficult to swallow, and when I have shared with them the tip about taking it with food, I have seen a huge success rate increase on people taking their supplements, that they literally will put it at the table next to their glass of water as they're enjoying a meal. And as they reach for a glass of water, a couple supplements goes in their mouth, drinking the water as they continue to eat the meal, doing that with 2 meals a day, your mid-morning or breakfast and then at dinner. Makes a huge difference for just the palatability of taking the supplements. If you're not one of those fortunate people that can take a handful, pop it in your mouth, a glass of water, and they're gone. That's not me. Right. I find that it's definitely not me. And so I really remember my supplements with food because it doesn't work for me without
and
food.
if you have trouble taking supplements, I think that's crucial. And the other thing I would suggest would be, Taking it right before a meal, especially your multivitamin and your other vitamins, taking it before a meal because it'll help you digest. If you take sometimes multivitamins or other multivitamins on empty stomach, because it's a concentrated version, sometimes you can get nauseous and you can actually throw up or have problems. So if your body's sensitive, take it with a meal. Obviously, there are some digestive enzymes or some proteolytic enzymes that are helping reduce pain and inflammation. Like, for instance, like bromelain, you want to make sure that you're taking that an hour before or 2 hours after a meal. Otherwise, rather than it being helpful in your body, it'll actually turn into a digestive aid, which obviously, if that's what you need, that'll be helpful. So I would say taking them with a meal. And a couple ways to do it, I suggest, is either sometimes it's, what I'll do is I'll take a handful of supplements and I'll just take a swig of water and dump them back. Other times people need to tilt their head forward when they swallow can help, or tilting their head back can swallow, or getting a little bolus or mouthful of food, chewing up the food, and right before you swallow, you can kind of trick yourself in putting that supplement or that vitamin in your food and swallowing it that way. So the supplements that I recommend, I know there was a study that came out in the Journal of Surgical Neurology that showed that people that took fish oil, now I know a lot of people are going to say, yeah, I already take fish oil, but hold on just a second. The study showed that people that take fish oil reduced people's pain with arthritis by about 60% over about a 2 to 3 month period. And about 75% of those people were able to disband completely their anti-inflammatory medications. So this is for arthritis. So we know that fish oil is a big one, and taking the right amount of fish oil. Most people take far too little fish oil. I suggest typically 2,000 to 3,000 milligrams of EPA and DHA combined a day. The other big one that I suggest is vitamin D. And I kind of joke, if you live north of the Mexico border, you need to take vitamin D year round. I've had some of my clients in Florida, as well as even in Hawaii and even Southern California, because obviously we work nationwide. I've had clients that have sent in their labs for review, and I've seen those people have some of the lowest levels of vitamin D. Now, of course, we know vitamin D comes from the sun. Well, why is that? Well, because people live in those areas, typically when they do go outside, they're either in the shade because it's too hot, or they have sunblock on. Right. So their natural ability to make vitamin D is therefore reduced. So I typically recommend supplementing year-round anywhere from 5,000 international units to 20,000 international units a day. For myself, I take about 20,000 units a day, and I like to suggest keeping a blood level, a vitamin D level around 80 to 120 is typically where we know humans typically should resonate. And if you look at your normal lab score, a normal lab, when you just get it generically printed off from the lab, we'll say 30 to 8, 30 to 100 is normal. We know that is a very skewed range and it's not updated. We know that optimal is at least 50 or above. I believe it's closer to 80, myself and other researchers. Other things I recommend would be taking a good multivitamin. If you're a female and you're still menstruating, take it with iron. If you're a male or you're not menstruating and you're postmenopausal, then I would suggest a multivitamin without iron. Another big one that I like, of course, is magnesium. Taking magnesium on a daily basis is crucial. CoQ10 is helpful for reducing aging, wrinkles, muscle gene expression. It's an antioxidant, wonderful. And another one that I'm really excited about, of course, is a new one that we were coming up with called Clinical Inflammatame. And one of the things with Clinical Inflammatame that I'm really excited about is that it has a whole blend of anti-inflammatory chemical, actually even some of like the white willow bark type extracts and other things that are very anti-inflammatory that can reduce joint swelling, arthritis, pain, etc. That I know that a lot, like I had a gal that came in, it was actually 2 days ago. I was actually doing a reeval, and she came in and she had arthritis so bad in her hands that she couldn't grip her hands. And her previous doctor said, well, for how much arthritis you have in your hands and your elbows and your neck and your back and your joint, he said, you can just kind of gauge what bad your arthritis is by how well you can open or close your hands over the years. That was the barometer, and that's he said, well, have a nice life. And she came in and she was so excited because she said, Dr. Gala, since I've been taking this Clinical Inflammatame, what I've noticed is that I can close my hands so much more. Wow. And she said also when I deviate or I forget to take it or so, that my stiffness starts to come back. She said overall it's progressed quite a bit and some of her results have been more lasting. But I thought for her it was a great testimonial in terms of her hands, and she was showing me how stiff they were, that when she would take this, of how fast her hands and her flexibility would be able to come back. And the thing, again, I like about supplements versus medications is supplements are things that are naturally found in nature, but in dosages higher and with other compounds that make it synergistically beneficial versus drugs. really focus on one pathway, and it's at a concentration that's much higher than you'd normally find in nature. So any other things that you'd like to say about pain in general, or supplements, or anything that we talked about today, that you'd like to say in closing remarks?
Yeah, I would like to go back to one thing. I was just thinking a little bit about nutrition, because I know, we briefly talked about the importance of changing your eating habits, that's going to be huge for decreasing your inflammation. And when you talk about, dairy and grains and so forth, to me, what was really important, and it's very important for many of our clients to success, is that they do remove from their house the foods they know they need to avoid. For me, for example, when you first shared with me, Mom, I want you to change, your diet, and these are the things I don't want you to eat. Well, wheat thins was my snack of choice at the time. When I was suffering from this debilitating fibromyalgia, wheat thins, I would eat probably a cup of wheat thins a day throughout the day. And so I began to eliminate the foods that you had said, but there were a couple boxes of wheat thins still in my pantry. And I would find I'd still go to those a couple times a day, just a couple. And 2 weeks into this, and I realized, and you calling me and saying, so how are we doing? It's like, I'm still eating wheat thins. I had to get rid of them. I literally gave them to a neighbor. I said, you want these? Because I had a box unopened and a box half eaten. And I just said, you want them? She said, well, yeah. Looked at me kind of strangely. And I said, I just decided they're not healthy for me. I can't eat them. And she goes, okay. And that was huge. So getting the food out of my house, out of my sight, it was just too available if I really wanted. It's kind of like putting your clothes out again for the exercise the next morning. Get the food out that you want to avoid, because so much of it is the visual, and it's just setting your home up to support, what you want to do. I think besides getting the food out of the house that you want to avoid, it's also planning weekly menus. It's really planning out a menu week by week. What is it that I'm going to be eating this week, and then go grocery shopping once a week and bring those healthy foods into your house, and making sure that you have a variety of snacks, celery and almond butter, chopped up veggies with salsa, hard-boiled eggs, things you have in your house ready to grab and go that'll keep you from going for the cookies and the pretzels and the things you want to stop eating. Have healthy foods instead.
I think that's a good thing. It's obviously being stocked up, being prepared, having a game plan, and giving it time to overcome those things. I'm a firm believer, and I've seen this time and again with the tens of thousands of patients that have come through our clinics, that I would say that, if you take these things to heart, you can really start reducing inflammation.
Yes.
And if diet and nutrition is hard to do, then start just with supplements. That'll be better. Now, is it going to be the end all be all? Maybe. I know I've had some people that all they've done is make some supplemental changes and had great results. Other people, won't. So everyone's a little bit different, but start with what you can do. So maybe it's taking your clinical Inflammatame or your fish oil or your vitamin D or whatever it is. Start with that and add what you can and making that a habit. If you can make some nutritional changes, great. If you can plan ahead, great. If you can lay out your exercise and start walking, even movement, great. All of these things will start reducing your inflammation and therefore reducing your pain. And it can happen as fast as a couple of days to a couple of weeks, maybe even a month of getting this down. And the key is to get your inflammation down as low as you can for as long as you can through healthy avenues without the use of drugs or surgery. And the people that do this, that embrace it, I wish the best for you and obviously your family and everyone listening and watching this. But I really believe that you start making these changes and you'll be impressed at some of the health improvements you start making subtly and overt. And obviously you're going to notice other improvements, whether it's your energy, mental clarity, other activities that you are in your life that you'll notice improvements, not just pain. I know, even though we really talked about pain in today's segment.
Mm-hmm. And success does breed success. I know you just briefly mentioned that, but that is huge. And I know that when I first started out, going back 20 some years ago, I didn't start all of these things at once. It was baby steps. It was a little bit that I could do, added more and more. And as I felt better, I could do a little more. I felt better, I could do still a little more. To where fast forward, and here I am today with all of this. Is a part of my daily habit, my routine, and it's almost a no-brainer. And it can get that way, but it doesn't get that way overnight. So being patient with yourself, having your goals, with an S, and, little increment steps can be huge in helping you. And celebrate. I'd say also celebrate those successes. When you have your goal and you break it down to little steps and you achieve one of those steps, to find a way to celebrate in a way that you feel special, that feels good.
Wonderful. So get your habits in order, start making changes. And I'd say before you're done with this right now, tell yourself this: what's the one thing that you can start doing right now to start getting healthy that you're committed to and making that next step? Because every little thing you do is going to take you one step closer to being healthier. Versus obviously, health isn't you're either getting healthier or getting sicker. You're never standing still. So make your decision right now. What did you hear in this episode that you know that you can do and integrate in your life, and then do that. Set it in action and make a commitment to yourself to whatever that next action is. Do it. Don't think about it. Don't procrastinate. Just make a commitment to yourself right now and do it. So again, with my mom, one of the people I love most in my life, my inspiration, who's overcome her chronic pain, fibromyalgia, all of many of her health issues, our lead health coach. It's always wonderful being with you, Mom. Again,
you.
I'm Dr.
Be
Gala,
with you.
and here's to making the rest of your years the best of your years. We'll see you soon.
Thank you.
Thank you for joining us for another edition of the Longevity Podcast. I'm Dr. Thaddeus Gala, your partner and host in achieving confidence, clarity, and capabilities in living a quality of life to 150 and beyond.